Claudia Bell.
ALS is a disease. It's called a neurodegenerative disease. It's a disease that happens out of the blue, and what happens is you get weak.
Good morning.
It's a disease of the motor system, the voluntary motor system. And we have motor neurons in our brain and motor neurons in our spinal cord.
So about 10% of ALS is genetic. But in about 90%, we really don't know why people get ALS.
They'll come in, I couldn't turn the key in my car, or I tried to get out of the bathtub and I couldn't do it. My legs were weak.
And how did things kind of evolve since then?
I noticed that the blower got heavier.
Okay.
And then I was having to go sit down and just got mad, saying, why is everything feeling so heavy?
We're happy to be here.
ALS is always progressive.
The average survival is about 2 to 5 years with ALS.
There are some people who die in 10 or 15 years, but that's relatively rare. And there are other people who die in 1 year or 18 months, and that's also relatively rare.
Neuromuscular neurologist Jonathan Glass is the founder and head of the Emory ALS Center.
Average age of onset's about 58 to 60 years old, and literally comes out of the blue. Most people tell me, I've been healthy all my life. I don't even go to the doctor. How could I possibly get this disease? Have you fallen down at all? You can't stop it. It keeps going. And we know what's going to happen. People die. And they die because they can't breathe. And during the course of that disease, they lose their ability to speak, to swallow, to walk, to use their hands. And I'm going to go dictate some notes.
Which is why Dr. Glass has devoted his career and his research to deciphering and decoding this disease that affects 1 out of 350 to 400 people during their lifetime, so that one day, instead of delivering a diagnosis that feels hopeless, he can deliver hope and treatment.
So if you want me to come and chat, I can.
The multidisciplinary clinic Glass created 30 years ago,
Yeah, I think it's also part of the ALS.
and now leads with neuromuscular neurologist Christina Fournier, has a single goal: to address all the needs of the patients in one day.
On a clinic day,
The person with ALS comes in,
they will potentially see
speech therapist, nutrition, social worker, nursing.
a physical therapist, an occupational therapist.
In one room, it's kind of a one-stop shop, and the whole team is here kind of centered around the patient.
Hey, I was going to come see you next. Is that all right?
Glass and Fournier lead a close-knit team of specialists
You've been able to meet several people at the clinic so far.
committed to caring for people with ALS.
If you're already in that, you can save yourself the trouble.
Then once it gets approved, he orders everything, gets it in, builds it, and then comes to you.
For people with profound mobility issues,
Like, this is a specialty joystick knob. So.
the clinic is more than a convenience.
So I'm gonna let you pull backwards on the joystick.
Research shows it makes a meaningful difference.
Wow.
There's very clear evidence that multidisciplinary care in ALS actually improves outcomes. People live longer. They have better access to equipment. Their quality of life is better.
So the way the chair works is the direction you point the joystick is the direction we're gonna go.
So it really is like the standard of care in ALS.
In every room,
You'll either come see me or
experts attend to the growing needs of the patients.
it might be, I don't know how close it would be into the toilet.
I've heard mixed things from people that
And in
sometimes they
every
put all those
room,
documents in and
people
sometimes
who never imagined they would be here.
You have to hold here, but you also have to stabilize here if it's
No,
wrong.
but I have been dropping things.
Barbara Anglin's children are with her for her first clinic visit since her diagnosis.
Of course.
And I appreciate all of you.
Oh yeah,
We do.
we're happy to be here, and we're always here to help. Okay.
Today is her 80th birthday.
And this whole thing started when? Are you still walking at all?
No, I'm not walking.
Ton Doan is an Emory osteoarthritis and spinal fusion researcher,
How are you doing with your arms?
1 year into diagnosis.
You know, this is going to progress. You know that.
Yes, correct.
About whether you wanted to have a tracheostomy and a ventilator. Have you thought about
No, I haven't thought about that because I'm kind of waiting to That's impressive to deal with.
How have you been?
Good, really
Okay.
good, yeah.
46-year-old Nicole Buchholz is a consecrated woman of Regnum Christi,
I got diagnosed with ALS in 2019.
a lay Catholic who gave her life to God, faith, and service.
Sometimes they can put all those documents in, and then
6
sometimes
years
they
into
can't.
ALS,
Something that I've heard from
Nicole is now cared for by the sisters with whom she lives.
She's an adventure girl, so.
Here we go. This is your roller coaster ride.
Yeah.
Every room holds stories of families, love, fear, and worry,
This is better than.
and the experts who spend their days caring for it all.
If you've seen 10 people with ALS, you've probably seen 10 different trajectories.
Let me go ahead and just make sure we do this letter. It's
Social
a very
worker
short
Sarah
letter.
Penna helps families navigate insurance, equipment, and home care, supporting both the practical and emotional realities of an ALS diagnosis.
She was just diagnosed on Tuesday.
Breathe in. And put that mouthpiece on. Sharp exhalation. Good.
In one day, Barbara sees the entire team,
So this is just something to let gravity be your friend and help you slide back.
including Chad Jones, who is fitting her for a wheelchair.
This is letting you know which power seat function you're actually going to operate.
Things that would take weeks of scheduling and travel, accomplished in a single day.
Outside in the community, that's my